Good morning, everyone. Welcome to our 11 a.m. briefing. My name is Matthew Wright. I'm the Deputy Director for the Science Press Package at AAAS. And our 11 a.m. briefing today is Public Health Impacts of Wildfire Smoke. Our speakers this morning are Joseph Domitrovich, an exercise physiologist at the U.S. Forest Service in Missoula, Montana. Lisa Miller, a professor of anatomy, physiology, and cell biology at the University of California, Davis. Wayne Cascio, the director of the Center for Public Health and Environmental Assessment at the U.S. Environmental Protection Agency in Research Triangle Park, North Carolina. We will first hear from our speakers in sequence, and then we will open the floor to Q&A. A reminder that we must wrap at 45 minutes past the hour sharp so we can prepare for our next briefing. And a quick note that our speakers will unfortunately not be available for immediate follow-up because their session is starting at noon. But of course, we invite you to join them there, which will take place in rooms 619 and 620. It's one of those compound rooms here in this building. So we encourage you to join them if you are so inclined. And of course, you can probably catch them after that session for follow-up questions if you would like. So with that, I'll introduce our first speaker, Joseph Domitrovich.
Thank you. So wildfire smoke has been a topic of concern for the wildland fire agencies probably since the Yellowstone fires of 1988. And wildfire smoke is just one of the hazards or risks that wildland firefighters face on a daily basis. Overall, the exposure that a wildland firefighter experiences, the geometric mean is fairly low, but we have a lot of high spikes throughout the shift due to the environmental conditions that they're experiencing. That's somewhat different than what we see in our public exposures. The other thing right now is the long-term health effects with the changing in the fire environment. The fire season turning into a fire year is still greatly unknown. However, there's lots of ongoing work right now with the U.S. Forest Service and our collaborators here that are hoping to address that data gap. Over to Lisa.
Okay. Go ahead. Is it on? Oh, it must be on. Hi, everybody. Good morning. In addition to being a faculty member at UC Davis, I also serve as the Associate Director of Research for the California National Primate Research Center. We're one of 7 NIH-supported primate centers across the country. So that'll give you a clue as to what type of study work I will be talking about this afternoon. The presentation this afternoon will be an investigation of long-term health impacts of acute wildfire smoke exposure. In this case, I'll be discussing the health impacts of wildfire smoke exposure in a cohort of rhesus monkeys that live outdoors year-round at our center, and they live in large family units. What we experienced is the ability to study both study animals across the lifespan, particularly in the younger age group. Our study started actually in 2008, so over 10 years ago, when a series of wildfires in Northern California elicited a significant amount of smoke, approximately 200 miles south to our town of Davis, California. Since that time, my group has been following a cohort of animals since infancy up until this point where they are now over 10 years of age. So in monkey years, that's technically they're considered young adults. So overall, we will continue to track our animals for health outcomes, both respiratory and immune system outcomes, and continue to follow these animals throughout their lifespan.
So I wanted to thank the AAAS for the invitation to be here with you all today. I'm Wayne Cascio, as Matt said, the director of the Center for Public Health and Environmental Assessment at the EPA. And our center is part of the Office of Research and Development. So our role as scientists is really to identify new information, create new knowledge that really addresses some of these critical issues that we're experiencing relating to wildfire, and to work collaboratively with our colleagues at other federal and state agencies to have a more systematic and harmonized approach to addressing wildfire smoke and its public health implications. I mean, as you all have probably also witnessed, the images of Santa Rosa and Paradise, California are kind of indelibly etched in my memory. And also most recently down in Australia at the Australian Open when a professional athlete had to be assisted from the court when she was overcome by probably some sort of respiratory distress related to wildfire smoke exposure or bushfire exposure there. So this is something that's of great interest, but beyond those specific events that immediately affect communities, wildfire smoke can travel vast distances and can have significant impacts on urban areas. So there are three main issues that are increasing the public health importance of wildfire smoke in the United States. One is the increasing severity of wildfire, particularly in the West. Also, we have an increase in the number of people who are moving into the wildland-urban interface, so they're coming into contact with areas that are more likely to be burned. And also, we have an aging population. In my talk later today, I'll speak a little more about vulnerable populations and what percent of our population is really at higher risk from smoke. Now, EPA has long has done research in the area of smoke, but over the last decade, we've really turned our attention not only to measuring and also doing modeling, but also developing public health-related messaging to address risk. And what you've been seeing here are the QR codes for a large number of products that we've developed with our colleagues in the Office of Air and Radiation and also in other federal agencies such as the Forest Service, the Centers for Disease Control, NASA, and NOAA. So I just draw your attention to those, which are the best way to find them are on that smoke-ready toolbox for wildfire, and all the links to Air Now and to the Wildfires Conditions page and to the continuing education courses that we produced with CDC are all there. So we'd be happy to answer your questions.
All right, wonderful. Thank you all. We'll now open the floor to questions. All right, Linda in the front.
Hi, I'm Linda Mapes with the Seattle Times, and my first question is for Dr. Miller. So, what are you seeing in the monkeys? Are they getting sick? Are you seeing effects? What are you learning?
So this will be my presentation this afternoon, but basically what we're seeing, number one, is immune dysregulation, which we detect in peripheral blood samples. We also see changes in their lung function. Overall, the volume or the size of their lungs is actually smaller relative to their unexposed counterparts. We also find evidence of what we call remodeling. Specifically, it appears that their lungs are a little bit stiffer than normal. That said, the animal, we don't see a striking difference in morbidity and mortality in this group of animals. But they are still considered to be relatively young.
You said you have a range of ages among your cohort there. Are the younger ones more affected than the older ones? The other way around? Is there any change in the prevalence of effects in the ages of the monkeys?
Great question. So for this study, we focused on the animals that were exposed during this period of time when they were infants. So they were between 3 and 5 months of age when they were exposed. We also had the ability to compare their findings from these animals as they matured with adults that were present in the outdoor field cages with their infants. And we did not see any long-term effects in those animals. So it's primarily the younger population that's most vulnerable.
Okay, we've got Robin here, and then we've got a couple more.
Robin Williams from ABC Australia. Thank you, Wayne, for that illustration from Melbourne, the tennis court. When I left Australia last week, the temperature in Sydney had gone down to 113 degrees F, 45 degrees C. And we'd been living with smoke for weeks and weeks and weeks. And when I say smoke, it was 10 times worse than Delhi, which had the world record. So my question is, what happens when human beings or monkeys have that level of smoke for weeks, if not months on end?
Well, it's an excellent question, and it's one we are really prioritizing to get an answer to. I think that the experience of Montana, Sealy Lakes, Montana, was somewhat similar to that a couple of years ago, when during the summer, this particular small town in the United States, in Montana, was inundated with smoke for at least a couple of months. And these were fairly high levels. And so epidemiology studies are currently being done to try to get a better sense of how human beings do, in fact, respond to just a constant insult from smoke. We don't really have an answer to your question yet. One can presume it's going to be worse than shorter term exposures, but we don't have an answer yet.
We had a question over there, I think.
Kathleen Willett, a freelancer with Johns Hopkins University. My question's for Dr. Cascio. What are the measures that you advise in your guide to mitigate smoke exposure?
Well, first, it's important to recognize that certain segments of our population are at higher risk. And so individuals who are older and more likely to have coronary artery disease or chronic obstructive pulmonary disease are really identified as those who are at highest risk. Also children and probably pregnant women. And Dr. Miller's work is providing some really important insight into some of what those mechanisms might be. So it's older individuals, people with pre-existing chronic diseases, children, and pregnant women that we are primarily concerned about. And so we would like to be able to message to them that when smoke inundates their area, that they should try to stay indoors and limit their outdoor activities. Increasing activity or physical activity increases your respiratory rate and consequently increases your exposure. So we recommend that you not be exercising outdoors in smoke. Ideally, if someone has air conditioning, you would like for them to be running the air conditioner so that the filtering improves the indoor air quality. And something people frequently don't think about is you don't want to contribute to indoor air pollution while you're inside, avoiding the outdoor smoke. So, no candles, no incense, watch what you're cooking so that you don't generate a lot of indoor air pollutants. Beyond that, those are sort of the key things. There's somewhat of a controversy regarding N95 respirators. These are the mask-type respirators you can get at the hardware store. Some public health departments encourage them, others do not. So that is a research question that we would like to pursue to find out the potential value of N95 respirators, particularly those who are at higher risk. The concern is that if someone is using them, they may not be using them correctly, in which case they won't provide as much benefit. And it may make them somewhat complacent and get them outdoors doing things that they should otherwise not. During the campfire, I saw a lot of young people jogging with N95 masks during the camp wildfire. So probably not the thing to do. So.
Sarah Shipley-Hiles with the Missouri School of Journalism. So can you talk a little bit about the chemical components of wildfire smoke, how it acts on the body, and what are the differences between that type of smoke and other types of smoke that people might be more familiar with, like cigarette smoke or trash fire smoke or anything like that?
You want to take that one, Joe, since you study a lot more smoke than I do?
Yeah, so wildfire smoke definitely has some different components compared to, say, structure fire. With the wildfire smoke is primarily in a true wildland fire event, organic matter, biomass fuels. We do have some unique components. Out west, we have poison oak, poison ivy that will sometimes be a component of it. And then once you get into the urban interface, the structures, then some of those plastics and other building material become part of it and changes the composition. When it comes to wildfire smoke, the true wildfire smoke, we have carbon monoxide, we have particulate matter, benzene, or yeah, not benzene, but a few other kind of volatile organic compounds, things like that, versus some of these others that have some synthetics and things like that in it. So there's been some work with some universities. I know University of California, Irvine has done some work on wildfire smoke after some of the fires down there, trying to identify those things. And then primarily the work we've been doing with the U.S. Forest Service has been looking at just the carbon monoxide and the particulates. Those have been the two that we've been able to measure. I won't say easy is the right word, but easier than some of those others out there in the woods to try to quantify those levels.
Question?
So can I just
Yep,
continue? So as Dr. Domitrovich mentioned, particulate matter is an important component, particularly at a distance from the fires. And the nature of the particulates, depending on the fuel source, is actually an active area of research. And Dr. Ian Gilmer, who's sitting up there, just raised his hand, is actually doing that research at the EPA currently. So it's important for us to try to better understand the differential toxicological effects of the different fuel types, whether it's pine or oak or eucalyptus if you're in Australia, and also the conditions under which the fire occurs. Is it a really hot, flaming fire? Is it a smoldering fire? Is it a catastrophic wildfire like we've seen in California, or is it a prescribed burn which is being used to manage the fuel and try to prevent wildfire? So these are all really important issues that are yet to be resolved. We know a lot about the health effects of particulate matter. It's based largely on epidemiology studies and also animal toxicology studies and even some controlled human exposure studies. But we don't know if there are fundamental differences in the overall response of people to wildfire versus just the ordinary PM that we get from vehicles and industrial sources. From our epidemiology research, we really don't see much of a difference, except perhaps a slight increase in risk among children with asthma for wildfire smoke. But otherwise, it seems the risks or the hazard seems to be similar between the PM from wildfire and non-wildfire particulate matter.
Okay, got a question here. Then I believe you had a question. We'll come back to Linda, and then we'll come to this side of the room.
Hi, it's Tom Bonsi with Northwest Public Radio Stations. I have a question basically for the whole panel based on your current research. Is the public warning scale that we use on the radio, among other things, to say today the air is unhealthy for sensitive groups or it's very unhealthy, something like that, does that need adjustment in some direction, or are the warnings we're giving now based on PM readings correct?
Yeah, it's a good question. The current air quality index is really based generally on what we know about the toxicology in humans for particulate matter or ozone. And I think it does an adequate job in providing information for people to make informed decisions about their activities outdoors and their behaviors. I don't think it needs any adjustment. Now, if you're familiar with the Canadian Air Quality Index, you may note that they combine both particulate matter and ozone in their index, whereas we do not. the air quality index that's reported is going to be relate to the species of air pollutant that has the highest level. But ozone generally is not all that high in a wildfire event. It can go up though, but it's not the dominant problem.
Hi, my name is Chai Ho. I work for The Hill, and I'm also freelance. My question is about mental health impacts. So I have seen studies that look at PM counts and subsequent emergency department visits for psychiatric reasons. And is that something that concerns you that could be happening from wildfires as well? Because these studies have looked at PM levels that are actually below the EPA regulation suggestions, so it's deemed safe from that point of view. A second part of my question is there research into in utero with the rhesus monkeys as well? Because there are studies that see that with humans at least, PM exposure in utero affects lung capacity and neurodevelopment later on. So is there also research into neurodevelopment with the rhesus monkeys or impacts from in utero exposure? Thank you.
I want to take the second one
Sure.
first, then I'll do the
Okay.
first part of that after.
Certainly. So a short answer is yes. We're starting to look at the effects of exposure in utero, and this was actually a second natural experiment that took place 2 years ago in November 2018 when Paradise, California experienced what we call the campfire. During that period of time, that window of time, we had in our outdoor colony many pregnant females. So rhesus macaque monkeys are unique non-human primate species in that they are seasonal breeders. So it's very predictable. They are pregnant in the fall and give birth in the spring. So we tend to have large groups of animals at different ages and different gestational ages in predictable windows. So during that time, we had a lot of in utero exposures, and we fortuitously were able to collect a number of blood samples during that time, and we're following those animals out. I can't comment on any outcomes, but we are studying those animals.
So in response to the first question, which has to do with these effects on mood or other psychiatric conditions, it's a really important issue that we need to learn more about. You're in advance of meeting you all today, I actually looked that up to kind of see where we stood with respect to mental stress related to wildfire. And I actually could find papers going back into the 1990s on post-traumatic stress and stress in communities and in children related to wildfire events. Now, with respect to PM, there is a literature that's out there that talks about increased suicide, increased hospitalization for psychiatric conditions, mood disorders. But the EPA, every 5 years under its requirement of the Clean Air Act, brings together all of the available information to make an assessment, which was just released to the public at the end of 2019, the Integrated Science Assessment for Particulate Matter. And in there, if I can give you the link, you can actually read about this. At this point, there is insufficient evidence to really make a statement about that, but it's clearly something that we should be thinking about. Particulate matter, we believe, increases inflammation, systemic inflammation, as well as in the lung, and can have direct effect on the brain. And so it's not inconceivable that there could be an effect.
if I could add just one thing to what Wayne just discussed. In our animal cohort, moving forward, as I mentioned, our animals are adults now. We have a study planned where the animals will be wearing GPS collars. And this allows us to track the animals physically throughout their family units, but also in working with our behavioralists at our center, we'll be able to study their social interactions and determine whether that has been influenced by their exposure.
Linda, and then next. Yep.
Thank you. Linda Mapes with the Seattle Times. So one of the things we as reporters do is try to tell the public about risks, and the public is totally bombarded with information about risks. And the hardest thing is always to say, well, how big a risk? How worried should you be? And can you give any guidance as to just how big a problem is this? Is this the equivalent of smoking a pack a day? Is it? It sounds so variable. Number one, duration, exposure, type. It's almost impossible. I don't want to scare people for nothing. How big a deal is this?
Again, really, really important question because people by and large don't understand risk. Because you'll hear, you have a certain medical condition and your risk is increased by 100%. And oh my gosh, I'm going to die from that. And then you realize that the occurrence in the overall population is 1 in a million. And so it means that you have a very, very, very small risk of having a problem, yet relative to the population, because it's so rare, it may be increased by 100%. We are experiencing sort of the same thing when it comes to wildfire smoke. As I mentioned before, there are certain populations in our communities who are at a higher risk, but that risk is still quite small. And so people need to understand that we are really just we're providing some general guidance that they can avoid what little risk there is by staying indoors and avoiding the smoke. In a paper that we published in the Journal of the American Heart Association, I believe back in December of 2018, we described clinical cardiovascular events from Northern California wildfires. And there we were talking about what is the chance of having a heart attack or a stroke or a worsening of heart failure or an abnormal heart rhythm when exposed to smoke. What we really found was that the risk was largely in people over the age of 65 and when they were exposed to very high levels of smoke. And yet the number of additional or excess cases was actually quite small, measured in maybe tens or hundreds of cases total in the entire state over that period of time. So it's actually in actual numbers a very small risk to the population, but still to an individual with those underlying conditions, it's higher than it would otherwise be if they weren't exposed. The Journal of the American Heart Association. First author is Zach Wetstein.
We had a question up front.
Hi, Mitch Charlton from Western University and an NASW travel fellow. I believe all of you in your online synopses of your presentations discussed the need for more research on this topic, but research can take a very long time. There can be many hoops to jump through, whether it be ethics, funding, that kind of thing. So in the meantime, based on your understanding from the research that you have done, what are some things that policymakers need to be doing now to address some of these issues?
Well, let me just give one example of something we're doing in the Office of Research and Development that I hope addresses your concern. So we have a program we're calling Solutions-Driven Research. And the idea is really to identify a key question that needs an answer, that if you get an answer, you can put into action immediately and benefit the public. And so we're partnering with the Missoula City and County Public Health Department, neighbors of Joe. And the question that they posed was, we tell people to go indoors to cleaner air during these wildfire events. How do we know it's clean? And so it's a great question. And it's one that we actually could answer pretty quickly. So last summer, we instrumented a number of different buildings in Missoula, Montana, and made measurements both indoors and outdoors. And that data is being evaluated and will be available hopefully in the very near future at a conference. And so we will be able to provide that information to the county, but as well as publish it, so that's available to everybody. But that's something that we, started just within the last year, and we already have an answer. So we don't have to wait forever for every study. To do intervention studies, if one wanted to ask the question, would using HEPA filtering in a home prevent heart attacks or strokes or worsening heart failure or prevented obstructive pulmonary disease from getting worse, then you'd have to do a controlled clinical trial, randomized controlled clinical trial, which would take a long time. It would cost a fortune. So those are the kinds of questions, while we would love to have the answer to, we're limited to smaller studies where we can have surrogate clinical outcomes, like reducing inflammation and not necessarily clinical events. So those are going to take longer, but we're still hopeful that in the future those can be done and we'll have more definitive answers to guide public health guidance.
All right, want to get a couple more questions from this side of the room? Let's go up front here. Oh, sure, that's fine. Yep. Nope. No worries.
Hi, I'm Robert McClure from Investigate West. How would a person know if they were affected by wildfire smoke, short of a heart attack or something like that?
I don't want to dominate, but my colleagues here. Yeah, that's a great question, and the answer, I think you could probably personalize it. If you're in smoke, how do you feel? You may have itchy eyes, they may burn, you may notice discomfort in your nose or throat, you may cough. I mean, these are the common, what you might call subclinical signs of irritation of your airways. We were interested in that question as well, and we actually put together something called the Smoke Sense mobile phone app. Hopefully you all have it. And there are now 30,000 people who are using it. And it's a citizen science project where an individual who has it on either an Android or an iPhone actually can contribute their personal experience with smoke. How are they feeling? How much smoke are they being exposed to? It also provides up-to-date information on their local air quality as well as forecasts for the future, a map of the United States, where they are and whether there's fires nearby and where the plume is. It also has an educational component, teaches people about wildfire smoke. So it's available both on Google Play and on the Apple website. So we're collecting that data, and we'll be able to answer your questions soon.
Kathleen Willett from Johns Hopkins University again. Northern California, where in the Tubbs fire of 2017, I think over 5,000 homes were lost. And pulmonologists went on record in the local media to say that healthy people's lungs could be permanently damaged if they expose themselves. But Kaiser Permanente has a large presence in that area. And I don't know if any epidemiology studies are being done currently, but anecdotal reports have come out that even people who tried to protect themselves because of all the toxics in that particular smoke were affected. So I don't know if epidemiology studies are currently being done using Kaiser's database, but a suggestion that might be helpful to your cause.
Yeah, well, thank you for your suggestion. I don't know the status of what Kaiser is doing or not. and when you do epidemiology for these environmental health effects, it's key that you know what people are exposed to. And that's the challenge that we face. We use modeling, just very briefly, just so you have an understanding of how we actually assess exposure. We use satellite imaging from NASA, as well as some ground truthing based on EPA monitors or Forest Service monitors that are placed in the vicinity of the fire. And so, these are modeled data with their inherent uncertainties, and they're based on particulate matter, not what's in the particulate matter. We would love to have more detailed information like that, but right now we don't. As Dr. Domitrovich said, there are differences depending on what burns. In our wildfire smoke guide for public health officials, and also when we were developing that, we had a draft version that we sent out to public health officials, and they came back with a request saying, please give us fact sheets that we can distribute to people on frequently asked questions, and one of them was ash removal. So beyond what might be contained in the emissions from a fire that involves a home, imagine somebody going back to that home to clean up. Well, they need to protect their airways, and they need to wear proper respirators and clothing. And so we now have a fact sheet that provides that kind of information.
I think we have about enough time for 2 more questions. We got Robert in the back.
Robert Frederick, American Scientist Magazine. Whenever I go visit my doctor, they ask me about if I've ever smoked at any time in the past in terms of the permanent exposure or the permanent damage. I wonder if there's some research you could point us to in regards to how permanent it's likely to be. For example, with the rhesus monkeys, the young ones that have different lungs in size, is that going to be with them for the rest of their lives as adults? How about my colleague here, Robin? What time does his lungs start to become less inflamed so that he can breathe again normally? Thank you.
I can maybe talk a little bit on this, since typically your wildland firefighter is the one that is constantly exposed. So our hotshot crews, kind of the ones you typically see on our large fires, big fires, on average they're on fires 100 days in the summer now, from the early spring till late summer. And so right now we're doing a collaborative study with NIOSH, so the National Institute of Occupational Safety and Health, their Western States office, doing a multi-year, 3-year study following 6 crews pre and post season for 3 years to try to look at pulmonary issues, kidney issues, not just smoke, but overall health of the firefighters. So that we are starting year 3 this year on that. So hopefully about this time next year, some of those reports will be coming out on. We've been tracking their exposure during the season, time on fires, and then looking at those multi-year exposures and health consequences from that. And then we did a study a couple years ago where we went to our more senior firefighters that are on the verge of retirement now, and asked them, what health issues are you experiencing? And we didn't see cancer come up, but we think that's due to the latency period of cancer development, and these folks were in their 40s and 50s, so we don't know yet, but we did see cardiovascular health come up as compared to their general population numbers as an elevated risk. So we're doing some additional research in that right now.
Okay, we may have time to squeeze in 2 more. Oh, yeah, sure. Sorry about that.
It's okay. I can quickly comment. So we've been following our animals, as I mentioned, for over 10 years now. And so these findings appear, these health outcomes appear to be persistent. That said, there's some important caveats here. Number 1, our animals live outdoors 24/7, so their exposure levels were dramatically higher relative to the human counterparts that live in the area. So exposure was higher. In addition, their lifespan is accelerated. So, and that could certainly have an influence in the outcomes that we're seeing. So important caveats to our findings.
Tom Bonsi again with Public Radio. A quick follow-up on the Smoke Sense citizen science project. Have there been any surprises out of the results so far based on what people reported?
As you might expect, the adoption of the app really depends on whether people are being exposed to smoke or not. So if you look at the distribution across the United States of where it's located, you'll find the largest number of people in Washington, California, and Oregon. So it's very much driven by the large wildfires. And in terms of maybe one unexpected observation, I think it probably the fact that people really don't know that much about wildfire smoke and its potential health consequences. So they're actually learning a lot by using the app.
Okay, I think we do have time for at least one more question, if anyone. Okay. Well, in that case, we'll go ahead and let them off early to get to their session. And thank you all for coming. And thank you to our speakers once again. And again, if you'd like to join them for the session, we'd encourage you to do so. Thanks again.
Thank you.
Thank you.